the spinal nerve. Now, moving to the next thing is the blood supply. The blood supply of the vertebral column is going to be by three branches. One, we call it periosteal. Why? Because it wraps around the bone, the periosteal layer. So this is the body, okay, and this is the spinous process. This is the spinous. These are the transverse. If I have a blood supply that goes around the periosteal layer, connective tissue of my bone, I'm gonna call it periosteal branch. Perfect. If I have a branch that penetrates to the equator of my vertebral body, I'm gonna call it equatorial. All right, so the equatorial goes to the equator, deepens inside. The periosteal is only outside for the periosteal layer. So we have periosteal, we have equatorial, and we have the radicular. What is that? This is the most important branch of everything. Why? Because the radicular artery is going to go back, it's going to supply the important structures at the back, the facet joint, the important things here, and it's going to supply the spinal cord, the lower part of the spinal cord, the lumbar part, and the lower thoracic. So remember the radicular, we're going to talk about it into more details. So what are the branches that supply the vertebral column? The periosteal, equatorial, radicular. Perfect. Where are they coming from? Good question. Let's go to the next slide. Where would be the blood sources of the equatorial, the periosteal, and radicular? Think about your major blood vessels. If I have here my heart, if I have the arch of aorta, brachiocephalic, common carotid, subclavian, if I'm in the neck region, remember what was the most important artery? It was my vertebral arteries, you guys, from the subclavian. That should have been down. Anyway, from the subclavian, I have the vertebral. Remember the vertebral arteries? Okay, so from the subclavian, I have two vertebral arteries. And from the common carotid, we have external and internal carotid. The external will give you the ascending cervical. So these can give you the blood supply of the above region. Okay, that was the above region. What about the thoracic region and lumbar? Let's trace the aorta. The major blood vessel is my aorta. The aorta is going down. What are the branches of the aorta? Remember the thoracic, guys? I talked about the blood supply of the thoracic cage. Remember the respiratory module? What was coming directly from the aorta? The posterior interosseous, the posterior intercostal arteries. Remember, this is the thoracic cage. The aorta is at the back, so it was giving us the posterior intercostal, right? All the way up until level 11. After that, we cannot call it intercostal, we call it subcostal, right? So I'm just reminding you of what we've taken in the respiratory module. So in the neck region, the periosteal branch, the equatorial, the radicular, all the branches that supply the cervical region are coming from vertebral and ascending cervical. Now, as we go down in the thoracic region, we have the posterior intercostal and we have the subcostal. What happens in the lumbar region? We have also the lumbar branches, you guys. We have lumbar arteries coming from the aorta down, right? And as the aorta finishes as two common carotid, it has common iliacs. We have internal and external iliacs. Remember these in the reproductive module? Oh, sorry, I forgot. You haven't taken the reproductive module yet. Anyway, I think you've taken the major blood vessels in your foundation. This is the aorta. It finishes as two common iliacs, internal and external iliac. All right, internal iliac and external iliac. This is the aorta. This is the iliacs. From the internal iliac, we're gonna have important parietal branches. Parietal branch means it's a blood vessel that supplies bones and structures, not viscera. What are these parietal branches of the internal iliac? Internal iliac artery. This is your pelvis. Okay, this is your pelvis. They are the iliolumbar, lateral sacral, medial sacral artery. The medial sacral is coming directly from the aorta, from here. This is the medial sacral. So the medial sacral, the lumbar branches, the posterior intercostal, the subcostal, they are coming from aorta. But the iliolumbar, if I have iliolumbar and lateral sacral, they are branches of internal iliac. Okay? So this is a nice summary. I just explained to you from where they are coming. Listen to this one more time. It's going to make your life easy. So the arteries that supply the vertebral column are coming from major blood vessels. What's the major blood vessel in the cervical region? Is the vertebral arteries from the subclavian. It's also the ascending cervical from the external carotid. And now from aorta and its terminals. From the aorta itself, I have posterior intercostal, and the last one, we call it subcostal. When we come down to the lumbar region, I have lumbar arteries, also from the aorta, and I have median sacral or medial sacral, okay? And from the internal iliac, which is terminal branch, I have the iliolumbar and lateral sacral. So the iliolumbar and lateral sacral, they come from the internal iliac. But the medial is from the aorta itself. All right? Great. What about the blood supply of the spinal cord? The blood supply of the spinal cord is mainly coming from the vertebral artery, okay? Because remember, the vertebral artery is the major blood vessel above. So vertebral artery, vertebral artery. However, the posterior spinal can also come from pica. What is pica? It's the posterior inferior cerebellar artery. It's also a branch of vertebral, and we're going to talk about this in details in cerebellar videos. So don't worry about the pica. Do not ever worry about it, okay? Just remember that mainly the blood supply of the spinal cord, because now we're getting into inside the vertebral canal, we're talking about the spinal cord, they are taking their blood supply from one anterior spinal artery and two posterior spinal arteries. They are mainly coming from vertebral artery, all right? Now, why am I mentioning this information here? There is a very important, because I want to link to the radicular. Remember we talked about the radicular arteries, all right? That was already supplying the vertebral facet joints and stuff at the back, and I told you it runs back to go to the spinal cord. The radicular artery gives a huge contribution to the anterior spinal artery. So if I have a spinal cord segment, all right, if I have a spinal cord segment, I have two posterior spinal arteries and I have one anterior. All right, perfect. We know that these arteries are coming from the vertebral artery. Done. Why do you want to mention spinal cord here? And what's the link between the radicular and what we're talking about? You guys, in the upper 1/3 of the spinal cord, this rule is true. It's all about vertebral arteries giving you one anterior spinal and two posterior. When it comes down to the lumbar and sacral segments, let's say this is your spinal cord, all right? This is your spinal cord. If we are above here at the cervical region, this is from vertebral, all right? In the lower 2/3 of the spinal cord, in the lower thoracic region and upper lumbar region, here, most of the blood supply that comes to the anterior spinal artery, it's coming from the radicular arteries. We call it the great radicular artery of Adam Quicks. The great radicular artery is very important because it comes from the aorta. So if there is any injury to the aorta or any pressure on the aorta or any decreased blood supply at that region or any injury in any surgery, and if there is any problem to the great radicular artery of Adam Quicks, what's going to happen is that the anterior spinal artery that supplies the anterior part of the spinal cord is going to be impaired. The blood supply is going to be reduced. We will have ischemic injury. that will have a problem to the anterior part of the spinal cord. What will happen if I have a problem in the aorta that causes impaired blood supply from the great radicular artery of Adam Quiggs? We are going to have anterior cord syndrome. What does that mean? I'm not going to explain to you the symptoms and signs of the anterior cord syndrome because we're going to talk about that in the spinal cord. I just want you to know that the lower two-thirds of the spinal cord, the anterior spinal artery is taking its blood mostly from the radicular artery. And that is coming from mostly aorta or the posterior intercostal arteries. It's not from the vertebral. So if I have injury to the aorta or any problem there to the great radicular artery, I'm going to have impaired blood supply to the anterior part of the spinal cord, which will have ischemic injury, which will have problems to everything in front of the spinal cord. And this is what we call, this is exactly like the anterior cord syndrome. We're going to talk about the anterior cord syndrome not now, when we explain the spinal cord itself, because the spinal cord has a lot of tracts and nuclei, and you need to understand them first, the function of them, so that once you know there is an injury, you will be able to know what is the signs and symptoms very easily. So up until this moment, you need to know this great artery of Adam Quiggs. You need to know that it's mainly coming from the aorta and or the posterior intercostal. It's not from the vertebral. It supplies the anterior spinal artery. And if there is a problem in that, this will end up having anterior cord syndrome. All right. What would be the innervation? In any spinal cord segment, wait, guys, I think I need to explain. All right. Okay. I should have explained the spinal cord at the beginning, but that's fine. If we have the spinal cord, all right, we have sensory root at the back, posteriorly, S sensory, and we have motor root anteriorly, ventral. Together, they will come to form the spinal nerve. So the spinal nerve is going to be mixed, and that will give you posterior rami and anterior ramus. The anterior ramus will supply structures in the ventral body and your limbs. The posterior ramus will supply the muscles of the back. Why am I mentioning this here? Because I want to tell you that very simply, the innervation of the spinal cord is going to be a branch from the posterior ramus and from the anterior ramus. Okay? If the branch is coming from the posterior ramus, if you guys look at, this is your body, the vertebral body. It means this is anterior and this is posterior, right? So number two, which is an artery that comes from the anterior ramus, it runs back. Okay, so this is an artery from the anterior ramus. It runs back because it wants to supply the spinal cord and the vertebra itself anteriorly. So from the anterior ramus, I have something called recurrent meningeal branch. Why do we call it recurrent? Can you guys see the recurrency of that nerve? Because after the spinal nerve left everything and it gave us anterior ramus, the big anterior ramus, it gave a branch that runs back. It runs back because it wants to supply the vertebra itself. So that's why we call it recurrent. Why meningeal? Because it wants to supply the meningeal layers. It's a branch of what? It's a branch of anterior ramus. All right, what is the other branch? The other branch, which is number one, it's a branch from the posterior. You guys, if you look at the spinal cord, remember we said that we have sensory root, dorsal root, and this is the dorsal root ganglia, and we have motor root. Together, they will form spinal nerve. The spinal nerve will divide back into anterior ramus and posterior ramus. The anterior ramus is bigger, of course, because it's gonna supply everything in the ventral body and your limbs. But the posterior ramus is just for the back muscles, okay? So this is very thin. So the branch from the posterior ramus that's gonna go all the way to supply your vertebral column, it's gonna be a medial branch because the vertebral column is in the medial side. So what is the other innervation of the vertebral column? It's the medial branch of posterior ramus. So again, what is the innervation of the vertebral column? We have the recurrent meningeal from the anterior ramus of the spinal cord, And we have the medial branch of posterior ramus, which is number one. It supplies the intrinsic muscles of the back and the facet joints. And the anterior one, the one that the recurrent meningeal, it supplies everything else. It's the most important one. And because it's called the recurrent meningeal, so of course it supplies the dura mater. Yeah, it supplies the dura, it supplies the pedicles, the blood vessels, almost everything anteriorly. And there will also be some communications with the gray rami communicants, and these are going to be the rami communicants are important in transmission of the pain fibers of the back pain. So this is also a nice picture. Remember, we had branches from the dorsal ramus. We call them medial branches. This is the dorsal ramus. We have medial branches. And from the ventral rami, this is the ventral ramus. And that will give you meningeal branch, recurrent meningeal. So the bigger one is the anterior ramus. And this is dorsal ramus or posterior ramus. The posterior will give you medial branch. So medial branch of posterior ramus. We have recurrent meningeal of anterior ramus. And we also have rami communicants related to the sympathetic trunk. And this is important to carry the pain fibers. Now we are coming here to the last part and very important part of the vertebral column. And first, we're going to talk about the typical and atypical. I already mentioned this previously, but we're going to just scan through, and then we're going to proceed to a very important topic, and we're going to end up this video with that topic, all right? So remember that we usually have the first and last vertebra from each group as atypical, and we already said why C1 and C2, atlas and axis, are different, and C7 from the cervical group. And T1 and the last thoracic vertebrae are atypical. And here, like I said, you guys go ahead and watch the anatomy of thoracic wall to know why they are atypical. I explained into a lot of details why exactly every one of the thoracic vertebra and why is it different. Structure explains function, and there you will know. And the last thing is when we come to the lumbar region, all of them are typical except L5. Why? Because L5 is the last vertebra that comes on top of fused ones. The highest range of motion in your body is on the L5 and S1 because L5 is the most mobile vertebra and S1 is the first immobile vertebra. So the greatest motion is here. So that's why L5 is different. So everything has a reason. I already told you why C1 and C2 are different because of the head movement. C7, why? Because here you will start a new group. Thoracic is mentioned in that. And here I told you why L5 is considered as atypical uh, um, vertebra, because the high range of motion and because it wants to accommodate between individual vertebra on the top, which is L4, and fused vertebrae down, and the structure of the sacrum is totally different. So that's why L5 is going to be different, all right? Now let's go ahead and see the last topic, a very important topic. It's an area of huge exam questions. A lot of exam questions can come from here. So please stay focused. If you're tired, go ahead and drink your coffee, pause my video and come back. And now let's see what we need to know here. I tried to simplify this fact because it's very complicated and it's very difficult. And I hope you can grasp this concept. Just listen to it a couple of times and then it's going to be a piece of cake. Now, if you guys look at the vertebral column and the spinal cord inside, you will come to know that you guys know that the spinal cord finishes at the level of L1. Okay? So after L1, L2, I don't have spinal cord. I have coda equina, and we're going to talk about the spinal cord in the coming videos. Now, what does that mean? It means that the spinal nerves will need to exit from the vertebrae where there is no spinal cord down. Now, what will that do? It will do as follows. the spinal cord segments are not going to be at the same level of the vertebral column levels. And you guys need to know each one of the vertebral column levels corresponds to which spinal cord segment. Why? We will say in the next slide. Now let's try to memorize in a nice way how we will know at each vertebral level which spinal cord segment is there. How can we know that? First of all, I want you to remember one thing. Spinal cord is only there up until the level of L1. So when we talk about vertebral level, don't expect that I will mention anything after L1. The last thing I have is L1. At L1 level, after that, I don't have spinal cord. So what I have here as a bony part, where is my laser point? As bony parts, it's gonna be all the way until L1. But when we talk about spinal cord segments, we have all the levels that have spinal cord segments up until L5 and sacral and even coccygeal spinal cord segments. All right. So what is colored here, it's from C1 all the way to the coccygeal nerves. The colored thing is the spinal cord segment. But the beige color here, the bony part, it's up until L1. I don't have anything other than that. Now, because we have spinal cord segments in all levels, I need to know from which level they are going to exit. Here we go. In the cervical region, in the cervical vertebral region, in order to know which spinal cord segment is there, you need to make +1. So if you are at the vertebra at C1, which spinal cord segment? It's C2. If you are at C2, which spinal cord segment? It's C3. All the cervical vertebral levels, you need to add 1. What about the thoracic? In the thoracic region, we only have cervical, thoracic, and then L1. What will happen in the thoracic group? We will divide the thoracic group into 3 parts. You guys know that we have T1, T2, T3 up until T6, and then we have T7, T8, T9. We have here 3, we have here 6, we have here 3, and then we have T10 all the way to T12. These are 3. Here we are trying to divide the thoracic to make your life easy. What will happen here, this, I'm gonna call them the kind group. The first thoracic, 6 thoracic are kind group. The next 3 thoracic are also kind group. But the last 3 thoracic are mean group. Why they are mean, we will know now. Now, first of all, the cervical region, +1. The first 6 thoracic, they are so kind. You will make +2. It means if I am at T1, the spinal cord segment is gonna be T3. If I am at T6, the spinal cord segment is gonna be what? T6, T7, T6, T7, T8. All right? So the first thoracic, you need to add 2. Cervical, +1. First 6 thoracic, +2. The same letter, thoracic, thoracic. The next 3, which is T7 to T9, you need to add 3. The next 3, you need to add 3. So if you are at the level of T7, T7 plus 3 will give you T10. So at the vertebral level, T7, which spinal cord segment is there? It's T10. You need to add 3. All right, is that easy? So in the cervical region, you need to add 1 to know which spinal cord segment is there. At that vertebral level, you need to add 1 in cervical region. Cervical region, add 1. The first 6 thoracic, add 2. The next 3 thoracic, add 3. And this is the kind group. And because they are kind, they have the same letter, the same name. And now, when it comes to T9, you will have the last thoracic, right? You will have T12. So now thoracic group has finished. What will happen in the last thoracic, the three here, the last three thoracic? They are the mean group. They will have a fight because now there is no more thoracic spinal cord segments. Now we are dealing with lumbar spinal cord segments, so they will fight. That the first one, T10, will take the first two lumbar. She's very mean, and she took the first two, L1 and L2. T12 vertebral level will take L3 and L4, the next two, because they are mean. T12, because the first two ladies are so mean and they finished all the levels, she will only have L5. So what spinal cord segment injury will happen if I have a fracture of T10 vertebra? It's going to be L1 and L2. Which spinal cord segment will be affected if I have fracture of T11? L3, L4. Which one will happen if I have fracture at T12? L5. And now the last one is L1 vertebra, and because this is the last one, all of the spinal cord segments will exit from here. So L1, because this is the last vertebral level, all of them will come out of this. All right? So this is a nice picture. You guys listen to this a couple more times. It will make your life easy. You can screenshot that, listen to this. Remember that again, the cervical will take spinal cord segment plus 1, the first 6 plus 2, the next 3 plus 3, and here the spinal cord segments thoracic will finish. Once you get to the last 3 thoracic, they will be mean, they will fight around the lumbar segments, and because they are mean, they will take spinal cord segments from different group. This is T, but this is L spinal cord segment. And L1 is out of everything, cervical is mostly out of everything. All right? Now, this is a nice take-home message. Be cooperative, because when you are cooperative, you will get extra points. Extra point means we will have plus here. Preserving your identity. Identity, I mean that these are thoracic and these are also thoracic. These are kind group, all right? They are cooperative. You will just add extra points to the same identity as yours. Thoracic, then thoracic. You just extra points. But if you are not cooperative, you will fight and get from other groups losing your identity. What do I mean by that? I mean that when they are not cooperative, they had to take spinal cord segments from the lumbar group. These are the last thoracic vertebrae. And regarding L1, it will take the rest of the spinal cord segments. Why is it important? Because you might have an exam question that will tell you if there is a fracture in this level, which manifestation will you find in the patient? Number one, you need to remember this. You need to know at the fracture of, for example, if you have a fracture at T12, which spinal cord segment is there? T12, which spinal cord segment is there? L5. Once you know it's L5, you have to go ahead and study the spinal cord injury and talk about the signs and symptoms. I'm not going to talk about the spinal cord injury now because that will be covered, inshallah, in the spinal cord videos. All right, so this is very important information. The last thing we have here is in the epidural anesthesia. Where do we usually put the anesthesia, or where do we usually do the spinal tap? That will all have to be below the level of L2 because you don't want to injure the spinal cord. And in that case, you will ask the patient to do flexion to spread away the bony parts of the lamina and the spinous processes so that you can put the injection. And if you want to, for example, do the spinal tap, you need to withdraw CSF from around. You don't want to injure the spinal cord. Of course, this is not the spinal cord. And also, if you want to do injection and put anesthetic agent, you also need to be away from the spinal cord because you don't want to injure it. And yeah, so the level should be L3 or L4, and L4 and L5 in children because the spinal cord of the children is at lower level than us. All right. So these are the references in this video. I hope you guys grasp all the concepts. I hope that made your life easy. Just listen to this video one or two more times. You can go ahead and screenshot this nice, colorful um, slides and study that. And I wish you all the best and see you in the next videos. Thank you. Bye.